For older adults, the decision to get the updated COVID-19 vaccine is easy. Rates of COVID-19 associated hospitalizations among adults increase with age. Adults 75 years of age and older are hospitalized with COVID-19 about 24 times more often than adults 18 to 49. During pregnancy, receiving an updated COVID-19 vaccine is recommended by the Professional Society for Obstetricians to protect both mother and infant. What if you're not an older adult or pregnant? Talk to your healthcare provider for personalized guidance about getting an updated COVID-19 vaccine. In this video, we'll describe some benefits and considerations of COVID-19 vaccination for those working in long-term care facilities. Let's start with three main benefits. The first is protection against severe disease. COVID-19 vaccination is quite effective at preventing severe illness, hospitalization, and death. The vaccines reduce the risk of hospitalization by about 50% in the first 2 months after vaccination, decreasing to about 30% after 10 months. The vaccines reduce the risk of critical illness, including death, by nearly 70% in the first 2 months and by about 50% after 10 months. It's especially important if you're 50 or older or have an underlying medical condition because you're at higher risk of severe outcomes. These underlying conditions include diabetes, heart disease, asthma, and chronic lung diseases. Even if you already had COVID-19 disease or previous vaccination, getting an updated vaccine against the most recent variants will strengthen your immunity against future infection. 2. Reduced risk of long COVID. Compared to unvaccinated people, those who are up to date on their COVID-19 vaccination, even if they have a breakthrough infection, are less likely to develop long COVID. At the pandemic's onset, approximately 10% of people who suffered COVID-19 infections went on to develop long COVID. Now, that risk has dropped to about 3.5% among vaccinated people. Long COVID is a complex set of symptoms some people experience after getting sick with COVID-19, even if it was a mild illness. Symptoms can include brain fog, shortness of breath, extreme tiredness, and many others, which can be disabling. 3. Protecting people around you. Getting vaccinated may help reduce the risk of spreading the virus to your loved ones, co-workers, and residents at your long-term care facility. What are facts to consider when deciding to get COVID-19 vaccine? Some people have minor side effects from COVID-19 vaccination that last a day or two. These may include pain at the injection site, tiredness, headache, muscle aches, or fever. Side effects mean your immune system is gearing up to fight COVID-19 virus. They can usually be handled with over-the-counter medicines like ibuprofen. Rare but serious side effects. A person may have a severe allergic reaction that requires epinephrine. This is why monitoring for at least 15 minutes after vaccination is recommended. Severe allergic reactions to COVID-19 vaccine are extremely rare. This happens in about 4.7 per million vaccinations. This is like comparing 5 grains of rice to all the grains in 142 pounds of rice. Very rare cases of myocarditis and pericarditis have been reported, mostly in adolescent and young adult males. Most resolve quickly with rest in medicine. Cases of myocarditis and pericarditis happen more often with COVID-19 disease than with COVID-19 vaccine. To recap, the main benefits of getting the updated COVID-19 vaccine are protection against severe disease and long COVID, and protection for people you live and work with. There are common minor side effects that you can handle without a doctor visit. More serious side effects that require medical care are extremely rare. Consider what is best for your health, your family, and the residents in your care when making decisions about COVID-19 vaccines. For more information, contact your local primary care provider or state or local health department.